animals can suffer from what I had assumed previously be uniquely human psychiatric disturbances. So OCD, obsessive-compulsive disorder, certainly anxiety disorders like separation anxiety. And then most interesting to me were learning that animals can have eating disorders. There is a kind of veterinary version of bulimia nervosa, and even an interesting syndrome that affects female pigs called thin sow syndrome, which has some connections to anorexia nervosa in humans. And then, of course, learning that, which I was very surprised about, that animals self-injure in response to stress and isolation. And, of course, we humans, unfortunately, sometimes self-injure. There's a term for it psychiatrists use called cutting. And anyway, to learn that these kinds of psychiatric syndromes are, in fact, species-spanning was truly eye-opening for me.
And it has significance because we often debate about modern lifestyles and modern stresses and whether these are a factor in some of these conditions. If they're in the animal kingdom, what can we extrapolate from that? Right.
Well, for example, I mean, it's one of the things that the sort of the low-hanging fruit, let's say, is the potential to destigmatize certain mental illnesses in humans. So self-injury is a good example. I think that people who are suffering from this problem often feel ashamed. They feel it means that they're very disordered. Sometimes parents feel very guilty. I mean, there's a whole cascade of negative experiences around the problem itself. So learning that parrots in response to stress sometimes pluck out their feathers, or that stallions who are isolated and enduring social stress or boredom can become what they call flank biters, where they turn around and they bite their flank and over until it bleeds. I think for some patients, knowing that they are not alone, that we humans are not alone in having these problems, can help reduce shame and, in some instances, self-blame. That's particularly relevant, again, in the self-injury, eating disorders, but also in the area of addiction. Because in my experience, individuals who are suffering from alcoholism and drug addiction deal with a tremendous amount of stigma. And in our research, Catherine and I learned that many animals in the wild are known to seek out psychoactive substances and in some cases become drunk and in some cases become high. And some of them, like some of the wallabies in Tasmania who go after the poppy straw and the poppy sap, or the cedar waxwing birds in North America who have a tremendous penchant for the fermented berries of the pepper tree, and they overconsume these berries. They gorge on these berries until they become drunk, and then they fly around in these drunken flocks. I think knowing that even in the wild addiction can happen also can be destigmatizing.
Welcome to our kiriru, our wonderful wood pigeon, which thoroughly gorges on berries before wobbling its way into windows. That is interesting, isn't it? Because the other thing with many of these conditions, and particularly for loved ones, is the desire to understand why is my child doing this. And again, if it is a behaviour that is not peculiar to our species, immediately it suggests that there is a reason or a rationale for it.
Mm-hmm. Yes, of course, a psychiatrist, I actually did some training in psychiatry before I trained in internal medicine and cardiology. And I remember the approach to a self-injuring patient. If say an adolescent girl came to my clinic with self-injury, my approach would be to start with talking therapy, with psychotherapy, trying to develop a talking bond, and perhaps medication would be part of the program, but certainly psychotherapy would be a cornerstone. Well, of course, a veterinarian you can't do psychotherapy with an animal. But what you can do, and what they do very effectively, is they look at the environment very closely. They look for stressors, social stressors, environmental stressors. They look to see whether the animal has sufficient enrichment. And most importantly, they evaluate whether the animal is isolated. And so without the passing of a single word between patient and doctor, they are able to devise an explanation and a very effective therapy. And I think this approach could certainly be used on the human side.
It's interesting because we probably associate some of these behaviours with higher level intelligence and in combination with psychological distress.
I did. I mean, that's exactly what I thought. In fact, when Catherine and I first asked the question, could an animal get an eating disorder or self-injure, we thought it was a really silly question. Now, years later, we are kind of amazed that we were that naive, actually. Many psychiatric disturbances, I think, we know that certainly anxiety and compulsions happen in cats and dogs, and in some wild animals in captivity as well. So, in fact, it's not our unique human intelligence that puts it at risk for some of these problems.
Coming back to the narcotics, one of my favourites was the poor little lizard that when it is licked by some other creature gives off a narcotic effect and spends its life basically being pursued by pleasure-seeking creatures. The use of narcotics certainly not at all uncommon in the animal kingdom.
Mm-hmm, mm-hmm. And it is interesting. I think it has implications both for understanding our brain chemistry, but also one of the stories we heard were about different animals in the wild and naturalists who had observed groups, and that some of the animals were more interested than others. So some of the wallabies, for example, jump over these barbed wire fences to access the poppies, and they continue to go back, and they can't get enough. Other wallabies maybe try once and don't go back. Others aren't interested at all. And that kind of variability is fascinating and certainly connects to what we see in human beings.
Again, it suggests a propensity in some creatures.
Mm-hmm, mm-hmm. There's some shared neurobiology and perhaps some early events that change the susceptibility.
Speaking of stigma, you also learn quite a bit about animal sexuality from observing the stallions, and we think of them almost in some ways as the pinnacle, I suppose, don't we, of
Sure.
reproductive creatures, and things like that not every day is the stallion up to the job, so to speak, and that sexual dysfunction is actually quite a normal part of sexual function.
Yeah, I learned a lot from watching how the veterinarians deal with animal sexuality. As you say, stallions are professional breeders. They are raised to be sexually healthy adults. And so the vets are very careful and thoughtful about how these animals should be raised, when they should have their first sexual experiences, how that happens. And they also explained to us that, on some days, it's really not going to be the right day for the stallion to perform, and they just take the animal back to the stall. It's not a big deal. But some of the most illuminating information that we learned while researching the book about animal sexuality was the prevalence of non-procreative sexual activity among animals.
Recreational sex.
Yeah, exactly. I somehow had this idea in my head that, we humans have sex for all kinds of reasons, but that I thought animals only have sex to procreate. But learned that many naturalists have been writing about, certainly same sexual activity, in many different species, masturbation and other kinds of non-procreative sexual activity.
In fact, I think in the ape world, a very sophisticated range of social sexual activities have been identified by researchers, used for everything from comfort to power trips and everything else.
Yeah, the bonobos, of course, are the most famous, of sexual beings, I guess, in the animal kingdom that we humans like to talk about. But we actually learned about it in many, many species, the use of sexuality for social bonding, for group affinity, for almost a kind of grooming, self-soothing kinds of behaviors.
Apart from the destigmatization that you're talking about, what are the other benefits of this, and particularly in some of the psychological behaviours? It was interesting, we were talking about intelligence. I think it was in the gorillas that it was determined they experienced clinical depression, for example. Again, is there something we can take in practice from these observations that we can apply to our own experiences?
Yeah, well, there are many. One of the most interesting for me is the issue of obesity, because, of course, I'm not sure in New Zealand if you have as big a problem as we do here in the U.S., but it is a very significant problem. We're in the midst of an obesity epidemic. And it turns out the vets are telling me that the dogs and cats, our companion animals, are also having an obesity epidemic.
The pets especially, cats and dogs living with us, really.
Cats and dogs, exactly. Animals under our care, because, of course, we're overfeeding them, we're under-exercising them. But I heard some remarkable stories about liposuction being done on dogs, and, oh my gosh, a high-protein, low-carbohydrate diet for obese felines that they call the Catkins diet, which is kind of incredible. But what was really interesting to me was learning that animals, domestic and then even some wild animals, when given access to abundant food, will overconsume and overconsume. Somehow in my mind I had this kind of fantasy that, unlike us humans, animals would eat until they were full and then would stop, that they had some internal
regulation.
But I learned that it is the environment that is the determinant of how much an animal eats, both in nature and in our homes. And I think that perspective could help us think about how we deal with the obesity problem, in our families. And specifically, if you asked a wildlife vet or you asked even a domestic vet, how would you handle an animal that was over-consuming and becoming obese, they would say, change the environment. They would make it harder for the animal to get to food. They would make it require more energy expenditure. So they wouldn't necessarily tell the animal, they couldn't say, you should eat less, exert more willpower. No, they would say, let's modify the environment, what they would call the obesogenic environment. And I love this perspective for human patients.
I'm very interested that you mentioned it can happen in the wild. I suppose in the animal kingdom it is often a case of gorge, starved, simply because that is the way they access the food source. Absolutely. Of course, what hasn't happened in the wild is that they've all got sedentary jobs and computers and TV sets these days. Their environment, in most instances, hasn't altered to the extent that ours has, and I presume they still eat things that pretty much are produced naturally and don't come in cardboard packets. Mm-hmm. So again, what's happened to the domestic animals has taught us a lesson.
Mm-hmm. Yeah. No, I mean, for sure, you can imagine it makes a lot of sense for a wild animal to be hardwired to overconsume when they have access to abundance, because of course scarcity is just around the corner. And so yes, these cycles of gorge fast are pretty common. But because the environment changes, it does kind of tend to regulate them to have a normal or a healthier body weight.
Yeah. Have you learned, and you've almost traversed this in some ways, have you learned much about the link between stress and physical disease? Now, this is interesting when it comes to animals because basically their lives in many species is literally made up of flight or flight style stress day in, day out. Can we learn anything about the link between lifestyle stresses and physical disease?
Well, I think that's a great question, and I'm really pleased that you framed it that way, because sometimes we know that our lives, our urban lives, let's say, are full of stresses that seem to be making us unwell. I certainly, as a cardiologist, have seen patients who have had a lot of